Hello, this is Module 4 of your CNA hybrid course on nutrition. The objectives in this unit are to identify 6 basic nutrients the body needs, identify a well-balanced meal, and define special diet modification or considerations for residents. Let's examine the terms nutrition and malnutrition. Nutrition is how the body uses food and fluids to maintain health. Proper nutrition is like the placing of quality fuel in your car. You will get better performance if you put in the quality fuel. The same applies to the quality food that you place in your body. You should expect better performance. Malnutrition is the lack of proper nutrition, whether it is from insufficient food intake or an improper diet. Common problems that can affect nutrition are as follows. Side effects from medication. That may cause nausea or loss of appetite. Some medications can also cause dry mouth, making it difficult to chew and swallow. Lack of activity and mobility can decrease a resident's appetite. Depression or lack of interaction may also curb an appetite. Stress can be an impact. Most of us eat because something smells and or tastes good. Would you eat the same if you could not smell or taste food as you once did? This is what's occurring in the residents. We also eat with our eyes. Loss of eyesight may change your appetite. Lack of teeth or poor-fitting dentures make it harder for us to chew. We as humans need 6 basic nutrients to survive. Water is the most essential nutrient. It sustains our life. Our bodies are at least half to 2/3 of water. Most adults will need 64 ounces of water every day just to maintain a healthy fluid balance. Water helps with a number of things, such as digesting and absorbing food. Water will also help maintain our normal body temperature. Fats are an excellent source of energy for humans and help flavor the foods we eat. There are many types of fats, some that are animal-based and some that are plant-based. 4 categories of fats are saturated, trans fats, monounsaturated fats, and polyunsaturated fats. The saturated and trans fats are known to increase levels of cholesterol in humans. This is why we are encouraged to take in these types of fats sparingly. Examples are found in red meat. Mono and polyunsaturated fats are good fat that may lower the risk of cardiovascular disease and type 2 diabetes. Examples can be found in nuts and fish. Carbohydrates are also a great source of energy. Some carbohydrates may supply protein and provide fiber to the body, especially the unrefined whole wheat products. What are some of your favorite types of carbs? I think of pasta, bread, I think of sweets. Even fruit is considered a carbohydrate. Protein is needed by every cell in the body and is essential for tissue growth and repair. It can supply energy for the body. Sources of protein can be found in meat, eggs, and nuts, just to name a few. Vitamins. Vitamins, as a group, are substances needed by the body to function. The body itself cannot produce most vitamins, and without good food intake, the body cannot absorb vitamins. 2 types of vitamins are fat-soluble and water-soluble. Fat-soluble vitamins are vitamin A, D, E, and K, and are stored in body fat. These vitamins can become toxic to a person if too much of the vitamin is consumed and stored in the body. Water-soluble vitamins are B and C. Once the body has enough of these types of vitamins, any excess will be eliminated in urine and feces and not stored in the body. Minerals form and maintain body function while providing energy and processes. A few examples of minerals that the body needs include zinc, iron, calcium, and magnesium. Providing a well-balanced meal includes appropriate amounts of carbohydrates, protein, oil, which is also a fat, and vegetables and fruits. One method to balance the meal is to use a food recommended guideline like My Plate. My Plate visually divides the plate into appropriate serving portion sizes for the meal. The plate should be at least half full of fruits and vegetables. Half of the grains should be whole grains, and the protein should be from lean meat and poultry, beans, nuts, and seeds. The dairy serving should be fat-free or a low-fat dairy product. Additional tips for making healthy food choices include a balance of calories from both food and fluids. Calorie intake will vary from person to person. Enjoy your food, but eat less. Recognize when you are hungry and when you are full. Stop eating when you feel full. Eat more nutritious foods like veggies, fruits, whole grains, and fat-free or low-fat dairy products. Limit the sodium or salt intake. Read labels as processed foods contain increased levels of salt. Drink water instead of sugary drinks. Sugary drinks add unwanted calories. Special diets are often ordered for residents who have certain illnesses or conditions. Always, always, always check the diet card on the meal tray before serving the tray, as well as looking at the food that's on the tray to prevent serious problems from serving the wrong diet. An allergic reaction or consistency could cause death. Some special diets that a resident may be on include the following. Liquid diets. Those foods are liquid at room temperature. Mechanical soft diets. This diet restricts or eliminates foods that are hard to chew and swallow, such as raw vegetables, raw fruits. Meats that are hard to chew would be ground or chopped up finely to make them easier for the person to digest. Pureed foods are blended so no chewing is required, though they're not as thin as a liquid diet. Bland foods are consumed to produce and reduce irritation to the stomach. Spicy and citric foods are avoided for a bland diet. Lactose is a type of sugar found in milk or dairy products. People who are lactose intolerant will need to avoid the milk and dairy products. High fiber diets increase the intake of fiber to help with digestion. Low fiber diets restrict fiber due to too much diarrhea. Modified calorie diets use a doctor's order to allow for a certain amount of calories to be consumed for the resident per day. Low sodium diets limit salt. Most commonly seen with people who have heart or kidney disease is low sodium or no added salt, NAS. Vegetarian diets avoid meat and some may avoid milk and eggs. NPO. Sometimes a doctor will order someone to be NPO prior to surgery or before having blood drawn. NPO stands for nil per ossa. In Latin, that means nothing by mouth. If a resident is NPO, they should not eat or drink until told differently by the doctor. Dysphagia is the medical term for difficulty in swallowing. Signs and symptoms that a resident may have dysphagia include hearing frequent throat clearing, coughing during or after meals, spitting out pieces of food, gurgling sounds in the voice during or after meals, dribbling saliva, food or fluid, food inside the mouth of cheeks. These are all indicators that the resident should be evaluated to determine if a change in diet is needed. There are dietitians and speech therapists that can do further testing. Preventing aspiration. Aspiration is the inhalation of food, fluid, or foreign material into the lung. To prevent this, always place food in the non-paralyzed side of the mouth. Allow time for the resident to chew and swallow their food. Make sure that the food is actually swallowed before giving a resident another bite. Residents are to stay in the upright position for at least 30 minutes after eating and drinking. If in bed, place the head of the bed up in a 90-degree angle. Provide mouth care after feeding to clean out any potential food debris that may remain in the mouth. Another way to prevent aspiration may be in the use of thickened liquids. After being evaluated by a doctor or speech therapist, an order for thickened liquids may occur. Thickened liquids move down the throat more slowly, reducing coughing and limiting the risk for choking. Some beverages arrive pre-thickened, while others will need to be thickened. Dietary staff are usually in charge of thickening, but other staff can do this as well, with direction. If on thickened liquids, nurse aides cannot offer the resident any regular liquids, including water, unless otherwise dictated in the care plan. That means even during oral care, you cannot offer regular water for clearing their mouth. Here are the 3 types of thickened liquids. The consistencies could be nectar, honey, and pudding. Nectar thick is similar to a fruit nectar consistency, such as tomato juice. Honey thick has a honey consistency, and spoons can be used to help residents consume this liquid, as it is harder to drink. Pudding thick liquids have the consistency of pudding. A spoon will stand up straight in that liquid. The spoon will be needed to consume any of those liquids. Barriers to nutrition intake. Here are some common causes for nutritional problems. Aging. Aging, many may feel isolated and eat alone. Physical problems, such as paralysis, vision, digestion difficulties, are a barrier. Emotional problems, such as stress. Illness may prevent wanting of food. Financial concerns may not allow for good food purchases. Cognitive decline means forgetting to eat or forgetting how to eat. Odors from the environment or the food itself may also be unpleasant. Residents may unintentionally lose weight, which can be serious. Some signs and symptoms include needing help eating or drinking, eating less than 70% of all meals and snacks, complaints of mouth pain, having dentures that do not fit properly, which cause them to move around while chewing, having difficulty chewing and swallowing, which may lead to coughing or choking and can be a sign of dysphagia. Report these signs and symptoms immediately. Dining guidelines are suggestions to help the resident engage in eating. Follow a routine, encouraging structure in the resident's day. Assist with grooming to help promote self-confidence when in the dining room. Encourage the resident to use the adaptive equipment that will help them in their dining experience, like their dentures, their glasses, and hearing aids. Always offer hand hygiene prior to eating. Clean your hands as the CNA before feeding a resident. Suggest that they use the bathroom prior to going to the dining room. Ensure the resident is upright in a 90-degree position to reduce the possibility of choking and help them be comfortable at the table. Here are guidelines when serving a room tray. Wash the hands before touching anything. Check the diet card once again to ensure that it is for the right resident, the right meal, and you're in the right room. Allow the resident to do what they can for themselves. Offer to help them cut up food, set up the containers, etc. as needed. Do not touch the food with your bare hands. If you must move food, get a glove or use another utensil to move the food. Other guidelines to consider include using other assistive devices as necessary. There are special cups called nosy cups and built-up utensils that are easier to grip. Allow residents to do as much as they want to for themselves, even if it makes a mess. We have special equipment we can use, and we don't mind getting more food or cleaning up a mess. Always put the food on the stronger side so the resident is able to feed themselves, and also so that their food goes into the stronger side of the mouth and they can chew it. If working with a visually impaired resident, be sure to read the menu to them and determine what they want so they have what they want for their meal. This will conclude our first part of Module 4.